Well, thanks for making the time to take this quiz. Your result is being, made right now. It should be hitting your email inbox in about 30 minutes from now. And in the meantime, let's talk about your results. Hi, I'm Chad Earhart. I'm the owner of HealthyDoctor.Coach and the creator of this quality of life assessment. And based on the information you shared and a little I know about you and your situation, you would be what we would call Dr. HC. It stands for Dr. House Challenge. And I would encourage you to move towards the solution approach. Okay? So, in other words, if you were a TV doctor, you might be Dr. House in the TV show House. And Dr. Gregory House is brilliant physician. He's very well respected for his ability to problem solve, especially underlying issues as the head of the diagnostic medicine in a teaching hospital in Princeton. And the problem is that House doesn't seem to be able to figure out his own personal challenges, primarily physically, emotionally, and even at times mentally. Now, here's what that means for you. What that means is you probably have a specific personal challenge that frustrates you. It may be an emotional thing, like you've gone through death and grief, or a physical issue like an illness, or maybe it's some kind of a mental or a mindset issue like test anxiety. And it could possibly be a financial situation or any number of things, but it is something that you just can't seem to get past. And I'm sure it's very frustrating to you. That said, this approach is not without risk. In fact, one of the biggest mistakes most make who try the solution approach is as follows. They're smart, and so they try to figure things out on their own. And this pedestal that others put you on causes you to be more self-sufficient in your structure, and it can create pride, and it can keep you from finding help. You don't want to look bad in front of others, right? And you don't want to let others down. Well, even some of the latest research in JAMA, the Journal of American Medical Association, one that I read was in a randomized trial of about 88 physicians, and it said that those who seek help and use a professional coach reduce burnout and improve their well-being, right? And yet we tend to want to try to do this on our own. Now, let me explain. You see, left unchecked, this gradual shift towards self-sufficiency can have a significant impact on your life. It can cause you to feel like you have to shoulder everything in your life yourself. It causes you to think that failing is always bad. And yet that is how we learn, isn't it? I mean, we fall and we get back up until we learn to walk. And then that's how we learn from then on. Falling is not bad if you learn from it. But we have created this culture where we are not allowed to fall and fail. Now, don't get me wrong. I understand that there are life and death decisions, and they can be very serious. But this attitude can keep us from being free and find even a safe place to be honest. Again, I understand not everyone is trustworthy with our stuff, and so there is a tendency to hold it and to fix it ourselves, to put walls up, and we can get overwhelmed doing this. It can burn us out, and if we're not careful, it can actually cause us to leave the profession that we love. It can cause demotivation, and it can lead to depression, and even worse, to suicide. Half of the physicians and 1/3 of the nurses right now are showing signs of burnout. And one of the saddest statistics that I hold is that physicians are more than twice as likely to commit suicide than others. And that just shouldn't be. Thankfully, there are some scientifically proven, practical, and achievable steps that you can take to improve your personal outcomes and to become healthier. So here's what you can do almost immediately to start becoming more healthy and delivering a more quality of life mindset. It all begins with having a quality life plan, a plan that addresses these four key areas. 1, balance of priorities in work life. 2, solutions to your specific challenges. 3, clarity and focus of direction. And fourth, an understanding of your role and how it affects your relationships. So, using your quality of life plan can choose to create an ideal solution for your challenges. You can beat burnout and you can create a healthier you. Now, you might be wondering, well, how do you incorporate all four of those areas into your life, into your present overwhelmed environment, specifically if you're looking to maintain a solution approach that we discussed? And how do we do that without adding another thing to your life, right? Especially when you're already feeling out of balance. All right, let me move my notes here so I can see them. All right. Well, this is what I do all day, every day. I help doctors and medical professionals, young and old, just like you, create quality life plans that fit with your specific Dr. House challenged types. And for a limited time, I'm making myself available to you for a one-on-one live discussion to see if we are a fit, and regardless, to help you find next best steps for you. Now, I don't coach everyone, which is why I have this initial call. I do promise for you this: it will be private, it'll be a safe place for you to be honest, and it's going to be an intelligent conversation. And my hope is that it will bring hope to you, and it's going to help you accomplish what you want for your life and for your work. And in return, I trust as you get better, everyone around you will get better as well, and that will do my heart well. Because you've made the time to take this assessment and tell me a little bit about yourself and your situation, I'd love to invite you to this quick call for free. And on this call, we're going to be covering the research behind why this works. We're going to dive into your desired outcomes, and we're going to consider how to create a step-by-step quality of life plan for your specific situation as a Dr. House challenged type. Now, the only catch is this: because this is a live call and I'm hosting it live, you must register in advance. And to get access to my personal calendar today and this session for free, you can imagine my calendar fills up pretty quickly. So you must go ahead and do this right now while you're on this page and before this countdown timer at the top of the screen goes to 0. So go ahead and do this right now while you're on this page and you're thinking about it. Simply click the button below for access to me personally, and when you get to the next page, pick a date and a time that works for you and for me, and get this access for free. So go ahead, do that now, and I will see you on the other side just minutes from this very moment.